My dear students, Dr. Ashfaq over here, and as you are well aware, I have authored books for NEET PG, NEET DM, NEET MCH, as well as some of the books for USMLE examinations, MRCP examinations, and my lectures would be intended to get you right on the top there for your next examinations, DM examinations, MCH examinations, MRCS, MRCP, USMLE examinations. I hope my videos will benefit you a lot. I will be presenting my things in a very easy, simple and palatable form for you. Wish you good luck for your exams. Thanks a lot. My dear students, just going through the last few years questions from NEET, DM Clinical Pharmacology, DM Medicine, MRCP, I found that many questions have been asked about these medical conditions and the drugs which we are giving in the treatment and the mechanism of action of those drugs. Now, I will be going through diverse clinical conditions and the drugs in the treatment of those conditions. So first of all, I will be taking this important pulmonological condition which we give the name as pulmonary hypertension. In pulmonary hypertension, we have got the mediation of endothelin, and we know that there are two types of endothelin receptors, ETA and ETB, and there are these class of drugs which cause inhibition of endothelin. This drug was asked, what is the mechanism of action of Tesosantan? So Tesosantan basically is a non-selective ETA and ETB endothelin inhibitor. Now we are already aware of one drug, bosentan, the earlier congener of the same category. So we remember pulmonary hypertension and these two, especially these two drugs, Tesosantan and bosentan, very frequently asked. Then I go to an entirely different spectrum of diseases, the infective disease caused by Staph aureus. Staph aureus infections, you know, they are implicated in causation of acute bacterial endocarditis, acute mastitis, acute osteomyelitis, and we have got an important problem, MRSA, the presence of methicillin-resistant strains of Staph aureus. So MRSA infections tend to be more severe, and we have got this new component, a new drug which inhibits protein synthesis and acts on 30S subunit of the ribosome, which is basically a glycycline antibiotic, and the name is tigecycline. So tigecycline is a glycycline antibiotic used in treatment of Staph aureus or MRSA infections. So you kindly remember this drug as well. Breast CA, and after surgery of breast CA, we give certain drugs. Then we have to remember that there is this important estrogen, and estrogen causes cells to divide by acting on estrogen receptors. Now, estrogens in the body are derived from androgens, and androgen to estrogen conversion is a result of important enzyme aromatase. So we have got a class of drugs which we call as non-steroidal aromatase inhibitors, and letrozole is one drug which belongs to this category of non-steroidal aromatase inhibitors. What it causes, it blocks the conversion of androgen into estrogens so that estrogens don't act on estrogen receptors and there is no cell division or cell proliferation, and very important modality of treatment of breast CA post-surgery. Now, going to another spectrum, we have this class of patients who are bedridden for a long period of time following major surgeries like total hip replacement, and they are at a high risk of deep vein thrombosis. We have another category of patients on strokes. We have patients who are having atrial fibrillation, and patients after surgeries bedridden for a long period of time. And we use a new class of drugs in the prophylaxis of these events or in the management of these events, factor 10A inhibitors. And we have got rivaroxaban. Rivaroxaban is a new drug which has been recently asked, which belongs to the category of factor Xa inhibitors and used in prophylaxis of DVT, in treatment of atrial fibrillation, in treatment of strokes, and patients who have big surgeries and remain bedridden for a long period of time. Then we have got this important condition. I started with a pulmonological condition of pulmonary hypertension. I end with another respiratory condition in which we have got breathlessness, and sometimes this breathlessness can go more severe, and I'm talking about bronchial asthma and subsequent status asthmaticus. So bronchial asthma, it has been found that there are many mediators and many mechanisms by which bronchial asthma can be precipitated, and one important thing is that we have got increased interleukin 4 and interleukin 5 levels in these patients, and any agent which would block interleukin 4 and interleukin 5 would be beneficial in theory, but practically also it has been seen that IL-4 and IL-5 inhibitors have a potent role in asthma as anti-asthmatic agents. And we have got this drug which has been asked, suplotast. Suplotast is a drug which is given in bronchial asthma, an anti-asthmatic agent. Not only does it decrease IL-4 and IL-5 levels, but it has got an effect on eosinophils, eosinophil chemotaxis, which is very important pathogenic mechanism in case of bronchial asthma. Not only eosinophil chemotaxis blockade, but as well as it prevents adhesion of eosinophils to the endothelium and prevents the vicious circle of chemical release or mediation of symptomatology of bronchial asthma. So this suplotast is basically an anti-asthmatic agent. So you remember those endothelin inhibitors in the form of bosentan as well as tesosantan, in the form of diglycine as a glycocycline antibiotic used in MRSA infections, the letrozole used as a non-steroidal aromatase inhibitors, the rivaroxaban used as a direct factor Xa inhibitor, and suplotast used as an IL-4, IL-5 anti-asthmatic agent. I mean to say IL-4, IL-5 blocker, and a blocker of eosinophil chemotaxis, and a blocker of eosinophil attachment to the endothelium. I hope that this class will be beneficial to you and you will be remembering these important drugs and their mechanism of action. Thanks a lot.